Good morning, Namaste, and welcome to TimesHealth Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a trained yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga to give the best results to my patients. So today, we are going to discuss about different things. Like, first of all, we are going to discuss about what is limping and how to manage it. Second, we are going to discuss about the right technique of stair climbing, that is going up the stairs and going down the stairs. Third, we are going to discuss about squats. What are the right or correct techniques of doing squats? Fourth, we are going to discuss about how to get up from the floor, the different ways of getting up from the floor. And fifth, we are going to discuss about how to bend forward to lift something, or how to actually, what are the different ways of bending forward that people generally use. After that, we are going to go for some functional movement drill, and then few asanas. If time permits, I would tell you different asanas which will help you in improving all of these. So I hope we all are excited to go through these series of different movements and understanding them well. So let's start with the first one, that is limping. So I would like to ask you all, have you heard about what is limping, or have you seen somebody while they are limping? So can you tell me in the comment box if you have seen somebody limping, or have you experienced yourself when you start walking, you have experienced the limp. So I will just show you one thing, how people walk while they are limping. So you must have seen this thing, that when people are walking, limping, they are doing this. Have you seen somebody doing this before? Something like this, walking with this kind of a gait. Let me know in the comment box that if you have experienced yourself limping, or have you seen somebody limping like that. Okay, I'm waiting for your comments. While you tell me about whether you have seen somebody limping, I would tell you what are the different causes of limping. Okay, so the different causes of limping are something like, if there is a lot of pain in the lower limb. So generally limping involves some of the part of the lower limb. Okay, it could be hip, it could be knee, it could be ankle. Okay, Prachi ji says cramps. Pooja ji says when we got hurt. PT ji says yes. Prachi ji says sometimes experience cramps. Harish ji says yes, knee osteoarthritis. Yeah, so there are different people who are telling me yes, they have experienced themselves, or if there was any injury, or if there was any cramp, there has been this kind of experience of the limp. Alright, so yes, exactly what you have written down, that's exactly correct. Okay, so we have all experienced limp when there is some injury to the lower limb. There could be knee, hip or ankle, anything could be involved, or there could be arthritis that could lead to a limp. There could be some neurological conditions that could lead to a limp. Okay, or there could be overuse injuries also that could lead to a limp. Now, what is the management of this limp? Why it is very important to address this limp as soon as you discover it? Okay, it is very, very important that you don't adopt this pattern of walking, because that changes the entire muscle work of your lower limbs. Okay, so it's very, very important that you address this limp as soon as you start observing that you are limping, and do not continue to walk with that limp. I have seen many patients in my clinical practice who ignore their signs of limping, and that leads to a lot of muscle changes, and that actually aggravates the problems, and in fact the problem moves on to the other joint as well. Okay, so I had one of the patients who was telling me that the pain is in the right knee, but because he has continued to limp and walk, the pain has also gone to the left knee. So this kind of things can happen if you continue to walk with that limp. Now, what is the correct management of the limp? Okay, the first and foremost thing is to visit an orthopedic doctor or a physiotherapist to get yourself consulted for the limp and find out what is the root cause of the limp. So to address the root cause is the first and foremost step that you need to take. The second thing that you can do is you can use icing. Ice actually helps in reducing the pain and inflammation, and that can help in reducing the limp. Okay, why does limp happen actually? Because the person doesn't want to bear full weight on the extremity that is paining. So they tend to reduce the time that is there for the weight bearing on the limb. So they start stepping really fast. Okay, so that's why they form a limp. Alright, so now second thing that you can do is icing. The third thing that you can do is you can wear a protective brace. Okay, like for example, if the knee is the problem, you can wear a protective brace, that is a knee brace, which will help support the knee joint. If the ankle is a problem, you can wear something like an ankle belt or an ankle brace that will help support the ankle joint. So whatever joint is the problem, you can wear a protective bracing that will help in reducing the amount of weight bearing that is directly coming on the joint, and it will be shared by the protective bracing. Okay, another thing is very important is you become aware of the limp. Become aware that you are limping so that you can correct it. Okay, so that is very, very important that you correct your posture while walking and become aware that you are limping and address the pain as soon as possible. The next thing that you can do is if the limp is really chronic and you have not been able to address it for a long time, you can use a walking aid like a stick or a cane. Okay, so that helps in actually shifting the weight from this extremity, from the extremity that is paining towards the walking aid. So you can always use a walking aid if the pain is chronic and you have not been able to address it for a long period of time. A walking aid will distribute the weight into two parts, and that's how it will reduce the weight on the paining limb. Next thing is very important is address the muscles with the help of exercises, which can be given by a physiotherapist or an expert who actually can tell you what kind of exercises are supposed to be done in that kind of a condition. Alright, so it's very, very important that you address the limb as soon as it is formed and do not carry forward it for a long period of time. Make sure that it is addressed and you walk normally. So this was the first part, that is how to address limping. Okay, so what did I say? There were different parts. First is get an expert opinion. Second, use icing. Third, make sure that you are wearing a brace. Okay. Fourth, you can become aware of your posture. Fifth, you can use a walking aid if the limp is very chronic. Sixth, do exercises. And seventh is rest when you can. It's very important whenever a limb is painful to provide it adequate relaxation and rest. So make sure that you are resting and relaxing as much as possible. So this was the first part of our session, that is what is a limp and how to manage a limp with the help of different techniques. Now next part we are going to go for stair climbing. Okay. So I'm sure I have asked last time as well, how many of you take stairs and how many of you take elevators and escalators? So most of the people had said they prefer taking elevators and escalators, but it's very important that you take stair climbing on a regular basis so that your limbs are strengthened. So even if you are not doing some exercise, at least when you're taking stairs, you're using the strength of your limbs. Okay, so it's very important that you do stair climbing on a regular basis. Now we are going to understand what are the points that you need to take care of while stair climbing. Okay, so first thing is that when you climb a stair, you keep your leg on top of the stair. So it's very important that you keep the entire foot on the staircase and not just the front part of the foot. So I have seen many a times that people they climb the stairs really quickly and they forget to actually keep the heel on the stair properly. Okay, that can cause a lot of soreness in the calf or even strain on the knee. So it's very, very important that you keep the entire foot on the staircase whenever you are climbing. The second important thing is, because if you keep the entire foot on the stair, the next is that you're going to weight bear on that foot. Okay, so weight bearing will actually activate your muscles. If you're just keeping half of your foot on the stair and the heel is outside or even a part of the heel is outside, maybe the muscle may not get adequately activated. So it is very important you keep the entire foot on the staircase and then weight bear on the limb and then climb up the other stair. Okay, so this is the next point that I want to tell you. What are the muscles that get activated while stair climbing? The two important muscles that are very much required while stair climbing are the glutes and the hamstrings. Okay, so when you keep the foot entirely on the staircase, you need to activate your glutes and your hamstrings so that you can actually push yourself up onto the another stair. Okay, so that's the next thing that I wanted to tell you, that you need to make sure you can concentrate on your glutes and your hamstrings, and you can actually specifically activate those muscles while stair climbing. Okay, so you can press on your foot and then you can activate these muscles. Another very important thing is you can do a little forward lean while climbing the stair, but too much forward lean is not recommended. So I have seen many people, they lean forward a lot while climbing the stair. Okay, that can actually again increase the pressure on your knee, as the center of gravity or the line of gravity, it passes in ahead of the knee. So it is very important that you keep your body, you can lean a little bit forward but not too much forward while climbing the staircase up. Okay, so that's another thing that is very, very important. Next thing that I want to tell you is, whenever you're climbing the staircase, make sure that your knee is over your toes, is going over your toes and not inside or outside of your ankle. Okay, so that is another important thing that needs to be addressed, that your knee is not bending inside or outside, but it's going exactly over your toes. Okay, so that there is no injury to the ankle or there is no injury to the knee. I know we are not very conscious of climbing stairs, we just do it as a habit, but if we take care of these small things, many of the aches and pains can actually be avoided. So make sure that you take care of these few points that I am telling you. Next thing is very important is the core contraction. It is very important that when you are climbing the stairs, your core is very, very active, and that can again be told by the amount of forward lean that you have done, okay, while climbing the stair. If the forward lean is too much, that means that your core is not very active. So make sure that you are keeping your body a little bit erect, or slight forward lean is okay. Okay, so these were the few points that I would like to tell you that are the correct ways of climbing the stairs. If your lower limbs do not have that much strength, you can use a handrail or a railing on the staircase, and you can use that to climb so that you get some support while climbing. Okay, so not everybody might have that much amount of strength while climbing up these stairs, so you can use a handrail to climb up the stairs. Okay, next, if you want to strengthen, in case you are doing all of these things and all your mechanics are correct, if you want to strengthen the muscles, what you can do, you can skip one stair and you can take 2 stairs at a time and then climb up. That will actually, it's like a lunge in the exercise. Okay, that will actually strengthen your limbs a lot. So you can skip, you can do the 2-step theory. So you can skip one step, directly place your foot on the alternate step and then try to climb up. Okay, so that's a way of strengthening. You can also do interval training on the stairs. So to train your aerobic capacity, what you can do is, you can moderately walk at a moderate pace on the stairs, and in between you can choose to walk faster and climb the stairs a little quicker. So that's another way to train your cardiac or your aerobic capacity. Okay, so these kind of different things you can do on the stairs. You can also do lunges on the stairs. So keep one leg on one step and then try to lunge over there. That can be done. Or you can do calf raises on the edge of the stairs. So many things can be done just with a staircase. Okay, so these were some of the tips that I would like to give you for stair climbing. Okay, next we are going to understand how is stair going down, stair descending. Okay, so what happens while descending stair? What is very important while descending stair is that we are standing on one leg and we are lowering the other leg down to reach the lower step. Okay, so what is very important over here is the control of the knee on which we are standing, the knee, ankle as well as the hip. The entire thing, the control of that is most important. Otherwise, what will happen if we don't have the control? Either we will step like that, so we will lose control and step down with a slap of the foot on the ground, or I have seen many people walk like that. They turn their body and get down, turn their body and get down, because they do not have adequate control of the knee, hip and ankle. So while descending the stair, it is important that you gradually lower your knee and keep your leg on the next step. So gradually bend your hip, knee and ankle and keep your leg on the next step. So this kind of mechanics, understanding this mechanics is very, very important. But when you are lowering the knee, again it is very important that your knee is lowering down on the direction of the first two toes or along the toes, but it should not lower down inside or it should not lower down outside like this. Okay, if you are lowering it down inside or if it is going outside, again it can cause a lot of strain at the knee or the ankle. Okay, and eventually it will lead to knee or ankle pain. Okay, so this is very, very important that you make sure while you are lowering the leg, your knee is over your toes. It might cross the ankle, that is absolutely natural, but it should be over your toes and not inside or outside the toes. Okay, so this is about descending. Again, while climbing down, make sure that you're not leaning too much forward. Okay, so many people, they actually lean too much forward while climbing down. That can lead to a lot of strain on the patellofemoral joint or the front of the knee. Okay, so it's important to keep your body erect and gradually have that control on your lower limb so that you can bend your knee appropriately. Okay, so this is the next important point that I would like to tell you while climbing down. In case if you have any kind of problem in the leg, okay, there is one tip that I would like to give you. While going up the stairs, always use the good leg first. So if going up the stairs, use the right leg first. Okay, good leg goes first. In case and while coming down the stairs, use the bad leg first. So if the left leg is paining, while coming downstairs, use the left leg first to step down. Okay, so this step you can remember whenever you have any kind of problem in the lower limb, and you can go up the stairs and down the stairs comfortably. Okay, so these are the few points that I would like to give you for stair climbing. I hope it is clear. In case you have any questions related to stair climbing, you can write it in the comment box. Prachiji says, I do same mistake, half feet. Yes, many people do that, only half the feet, and we don't realize it because we have a habitual climbing of the stairs. So we don't actually pay attention that we are just keeping half the feet. That can lead to a lot of calf pain or knee pain. Okay, so it's very important that you keep the entire feet on the staircase. So these were some of the tips for staircase climbing. Next, Naveenji asks, how many stairs climbing is good for a normal person? So on an average, a flight of 3 to 4 stairs, a flight of stairs that includes 10 to 12 steps, okay, around 3 to 4 flights every day can be done on an average normal basis. But you have to take care what is your pre-fitness level or stamina that is existing. So in case if you do not have the stamina of climbing 3 to 4 flights of stairs, start with 1 or 2, that's absolutely normal, and you can gradually go up to 5, 6 flights as well. Okay, depends on your capacity and depends upon how good your muscle strength etc. is. Just make sure that you're not developing any kind of pain while doing this in the joints. Okay, pain in the sense the bad kind of pain. If there is soreness etc., that is absolutely acceptable. Okay, so this can be done. Okay, next we are going to go for what are the correct mechanics of doing squats. Okay, because if you want to do the stair climbing as well, you need to have a good squatting capacity or mechanics. Okay, so today we are going to understand what are the different points that we need to make sure while we are squatting. The first point that we need to make sure is that the feet should be shoulder width apart. Okay, so do not keep the feet together and squat, keep it shoulder width apart or 1 foot distance, a distance of one of your feet. Okay, keep that much distance between your feet. Okay, next what you have to do is when you are squatting, okay, so you go down like that and you come up like that. Okay, so when you are squatting, next thing that is that you keep the knees or legs parallel, the thighs should be parallel to each other. Okay, so you have to make sure that the thighs is parallel to each other. Okay, next what you're going to take care is you are keeping your chest up. Do not bend like that. Okay, this is not a good way to squat because this can lead to a lot of back pain. This is a very taxing position for the back. So make sure your chest is up and then you go down like that. Okay, this needs a lot of strength in the thighs as well as the glutes. So you need to train your thighs and glutes in order to do a correct squat. Okay, so this is next, which is very important, to keep the chest up. While going down, you need to have good control of your muscles. So go down only as much as you feel you have the control. Do not go down to a level where you lose control and it is difficult to get up again. Okay, so if you go down too much and then you are not able to get up, you might actually compensate for getting up. Okay, so make sure that you are aware while doing the squat. So you go down as much as you feel, yes, I have the control of my knees to go down to this level. Okay, that's another important thing. Next thing that is very important is that while coming up, you push your feet and then come up so that you engage your muscles. The entire lower limb muscles are engaged while coming up. Okay, the video is frozen it seems. We'll just check. Okay. Can you repeat the squat please? Okay, I'll tell you again. So while squatting, make sure that you have 1 foot distance. Okay, and you go down with a straight back. Okay, you do not bend forward. All right. So make sure that you go down with a straight back. Next important thing is you need to have parallel thighs while going down or parallel knees while going down. Okay, you should not have an outside knees facing outside or inside. The video is frozen. Can you? Okay, welcome back. Sorry for the technical glitch. Let's resume again from the squats. I hope everybody is able to see me now. Okay. So now we will resume from the squat mechanics. So it's very important that you do squats on a regular basis because it's important to train your lower limbs. Most of the activities involve kind of a squatting mechanics. Okay. So it's very important that you train your lower limbs for the same. So while doing a squat, you have to make sure that your feet are shoulder width apart. So like a 1 foot distance, okay, between your feet.
हाँ माना जी कुछ तो स्ट्रीमलाइट का ग्लिच लग रहा है क्योंकि यहाँ हमारे पास मैं सब कुछ चेक कर लिया यहाँ मैम का मूवमेंट भी दिख रहा है कोई स्क्रीन फ्रोज नहीं हुआ है हाँ और कनेक्टिविटी इशू भी नहीं है क्योंकि वी हैव मोर देन 400 Mbps का स्पीड हमेशा यस मैम और 40 मिनट में अपने आप डिस्चार्ज पता नहीं कैसे होगी
Hello everyone. I hope you can see me now. Can you please comment down if you can see the continuous video now? Perfect. Okay, so I have yes, yes, yes. Perfect. All right, let's move ahead. Thank you for your patience. Thank you for patiently waiting for me to come back. Now, let's go ahead with the squat mechanics. Okay, so what are we going to take care while squatting? Squatting is very important in our daily life, okay? So because most of our activities like getting up from the floor or sitting down on the floor or even sitting down on a chair requires a squat mechanics. So it's very important that you train the squats on an everyday basis, okay? So what are the points that you're going to take care while squatting? So one thing is that you're going to keep 1 foot distance between your feet, okay? Keep your foot shoulder width apart or a 1 foot distance between your feet, okay? Now the next thing is that what you're going to do is you're going to squat down. So while squatting down, make sure that you are not leaning forward, okay? The lean forward mechanism is not a good mechanism to squat because that can cause a lot of stress on the lower back as well as the knees. So you have to make sure that your back is erect and straight. Your chest is up, okay? So while squatting down, squat down with a straight back. It's okay to cross your knees across the ankle. It is going to happen. It is bound to happen naturally, okay? So the knees might go across the ankle. You can try to keep knee within the ankle as well and learn to squat that way. That is another way of squatting, but it's important that your knees are not falling inwards like this or outwards like this. Your thighs should be parallel to each other so that your knees are going over your toes, okay? So this is how you squat. Your knees should be going over your toes, not inside, not outside, but on your toes, okay? Because going inside, again, it can lead to a lot of strain on the knees as well as the ankle, or going outside again. So many people tend to do this while squatting to make it little easier, okay? But it should not be done that way, okay? You should not make it easy. Make sure you go down only as much as you have the control, okay? Do not go down up to a level where there is no control.
उधर से मैसेज आया
Rajkumar ji, yes, the recording will be available on the YouTube channel as well as the dashboard. I hope you can hear me. Okay, so I will continue again. So while squatting, okay, make sure you go down only as much as you have the control, okay? Do not go down up to a level where you lose control and then you have to come up, okay? So do not go up to that level, okay? So make sure that you are squatting up to the level where you have control, good control of your knees, okay? This is another point that is very, very important while squatting, okay? Harendra ji, ankle pain exercise. So I have taken a session on ankle and feet separately. You can go to that video and refer to that video again for the ankle pain exercise. Okay. So next, so if in case you have done the squats like this, if you're not able to control your upper body movement, alternative way to do a squat practice is go to the wall, okay? Keep your feet a little ahead, keep your back straight, head touch to the wall, shoulders to the wall, back touch to the wall and hips to the wall. Then slowly, gradually go down as much as possible and come up. So this will train an erect posture of your back while squatting down. Train this for a few days first, okay? Once you have trained this for a few days, you will be able to do the squat without wall support eventually, okay, and without leaning forward. So you're going to train your legs first by touching the wall, okay, and then doing the squats first, and then train it against without touching the wall and going down. In case if you want to keep your back erect and this kind of posture is not helping out, what you can do is you can keep your hands up so that you can keep your back erect, and then you can go down into a squat position. Okay, so this is the different points that you need to take care while squatting. In a squatting position, it's important to have a good ankle strength, a good knee strength, as well as a good hip strength while performing the squats. Okay, so this was the next point that I wanted to tell you about squats. If in case you have, I hope the squat thing is clear. If in case you want me to repeat any point, or if you want me to tell any point in more clarity, please comment in the comment box and I will repeat it again. Okay, so this was about squats. Next, we are going to see how to get up from the floor. So there are different ways that people adopt to getting up from the floor. It's important to have a good lower limb strength, core strength, as well as upper body strength for getting up from the floor. Okay, so let's see what are the different ways that people adopt to get up from the floor. The video is again paused. Jyoti ji, the whole squat pose is not clear. Paused again. Can you see me or hear me? You can only hear me. Okay. You cannot see me. We are working on it. Okay, so now moving. All right. So next we are going to go for getting up from the floor. So there are different ways people adopt, and no way is the correct way to get up from the floor. Okay, not a single way, but there are different ways that people use, and I'm going to demonstrate the different ways that people use to get up from the floor. Okay, so I'm going to sit on the floor, and now what are the different ways of getting up from the floor? So first thing that we are going to do is, many people, what they do is they go on to their all fours. So they turn their legs like this. Those who have a good knee mobility as well as strength, they go for this kind of getting up. They go on to their all fours like this. They use one leg forward like this and then get up from the floor. Okay, so this is one way of getting up from the floor. You sit like this, go on all fours, keep one leg forward and get up from the floor. You can also use some kind of a support system to get up from the floor in this kind of pose. So if a chair or something is available, you can keep a hand on one of the chair and push yourself for getting up from the floor in this kind of position. Another way that is getting up from the floor is, you sit down like this. Many people, they go on to a side sitting position, and okay, so what they do is they go on to a side sitting position. That means sitting on one buttock, okay, and the legs are folded. Then what they do is they go into a half kneel position. So go on to one of the knees, okay, a half kneeling position. Then keep one leg at the side. Okay, so go into a half lunge position. From this position, keep one leg at the side. Some people prefer to keep the leg outside, some people prefer the leg to keep it straight, and then weight bear and get up from the floor. So this is the second way of getting up from the floor. Okay, I am going to repeat this again. So you go into a side sitting position, you go on to half kneeling position. Okay, then keep one leg forward and then get up from the floor. So this is the second way of getting up from the floor. The third way of getting up from the floor is where people generally tend to go on to sitting into this position. This needs a lot of core strength. Okay, so you sit up like that with the knees bent, and then slowly try to cross your legs and then get up from the floor. Okay, so you sit up like in a sit up position and then cross your legs and get up from the floor. This is another way of getting up. And the fourth way of getting up is where people do not have enough knee mobility, where their knees are straight. Okay, they cannot bend much. So in that case, what people do generally is the legs are straight, take weight on their upper body. Okay, take weight on their feet and gradually drive themselves up by dragging their hands. So this is the fourth way, wherein if you do not have enough knee mobility, then you can use this way to get up from the ground. Okay, so this is another way that is seen of getting up from the ground. No way is the correct way. It depends upon what characteristics of your body that you have. If you have a restricted knee mobility, or you have less strength, or whatever are the characteristics, those are very important whenever you are getting up from the ground. Okay, so I just show you the last one once again. So what you do is the video is again paused. Okay, so the legs remain straight. You go onto your toes, gradually come up with the help of your hands. So this is the fourth way. Is the video still paused? Working. Okay, so I hope you were able to see the 4 types of getting up from the floor. Okay, I am going to demonstrate the 4 of them continuously one by one again. Okay, so the first way was where you go onto a quadruped position, keep one leg forward and get up from the floor. So this was the first one. The second one was wherein you are sitting on a side sitting position, you go onto a half kneeling position, keep one leg forward and get up from the floor. So this was the second one. The third one was wherein you are sitting up in a sit up position like this and cross your legs and get up from the floor directly if you have a good strength and good knee mobility. And the fourth one was wherein people who do not have enough knee mobility, the legs are straight and you go onto your toes and get up from the floor. Video is paused.
है।